Hi everyone, welcome to my page. Today we'll be talking about HIV/AIDS. Today is 1st December 2023 and today we commemorate World AIDS Day. We know what AIDS is. AIDS is acquired immunodeficiency syndrome and HIV, human immunodeficiency virus. So these are viruses that can be gotten from different ways, and when someone gets it, it integrates itself into the person's body and tries to suppress the person's immunity. And if you do not take care of yourself, if the person does not notice it early enough, it will go on to suppress the immunity and get to AIDS. And that's when the person start talking about stages of the AIDS. Now I'm going to use this opportunity to talk about how to prevent getting HIV virus, how to prevent getting HIV AIDS. Then what to do when you have HIV virus and the different methods to get HIV virus. My name is Dr. Bridget at OBGYN Talks with Dr. Adazion. I'm a consultant obstetrician gynecologist. Please, if you are not subscribed to my page, do so now. So as we said before, what is HIV/AIDS? HIV/AIDS is HIV is human immunodeficiency virus. AIDS is acquired immunodeficiency syndrome. Syndrome means when the virus has reintegrated in your body and it has caused depressed immunity. There are plenty in numbers and your body is now not able to fight infections again. So you have different forms of diseases happening to you. So some will have diarrhea, loss of weight, loss of appetite, and they'll be going down, cough. Some of them will even acquire TB on top of it because of the immune depression. So that's if you do not manage the HIV level very well. So now, how can someone get HIV virus? HIV virus can be gotten. The commonest route of transmission is sexual intercourse. When you have unprotected sexual intercourse with an infected partner, someone that has HIV virus, you may likely get HIV. Some of this sexual intercourse may not be voluntary. Some people that have been raped and they do not seek medical attention immediately, and peradventure the person that raped them is HIV positive, the person may transmit the virus into them and they will come down with HIV virus. So one of the commonest methods to get it is unprotected sexual intercourse. The second thing is use of sharing of sharp objects that are not sterilized, contaminated objects. So if you are using razor, you are using clipper, you are using shaving stick, you are using needles, any sharp object you can think of, even nail cutters, those people that give their legs to be cut for someone to trim their nails, those commercial trimmers to trim their nails, you are at risk of getting HIV virus if you use contaminated one. For example, if someone has used a clipper and that clipper is contaminated with HIV virus and is not sterilized, you can as well get that by having your hair cut and you have a mark or maybe blood comes out. Now the third one is through blood transfusion. If you go to a hospital that is not up to standard, let me use that word, and they transfuse a blood that is not well cross-matched, well screened for HIV virus, you may get HIV virus from blood transfusion. The next method of getting it is from mother to child transmission. Mothers that are HIV positive and they carry babies in their womb. There are things that can make someone get that baby to get that HIV virus. When you do not take your drugs and the viral load is so high, the possibility that your baby may get it is high in pregnancy. Now, during delivery, there are some things we do to prevent a child from getting HIV virus. So if you have HIV, it's advised that you deliver in a qualified hospital and let the nurses or the midwife or the doctors that will conduct your delivery know that you have HIV. It's not something you should hide from them. Then the third one is through breastfeeding. Now, intrapartum, what I mean is during delivery, after you have delivered your baby, there are other things we do. We start the baby on prevention, prophylaxis, to prevent the baby from getting HIV. So if you have a baby and if you are HIV positive and you are pregnant, make sure you register in a good hospital, take your drugs. Now, that will help you protect your child from having mother-to-child transmission as much as possible. Then the fourth, or so I don't know the number we are right now, is breastfeeding. If you are HIV positive, there's a way we advise you to breastfeed. We don't encourage misfeeding, and most times we place the baby on prophylaxis and review later. That's about mother-to-child transmission. Then, let me not go to prevention yet. How do we stop one from getting HIV? How will you prevent yourself? Let me go to prevention now. How will you prevent yourself from getting HIV? Let's go to with ABCD. Number one is abstinence. If you are not married, if you are still a young girl, please, we encourage you to abstain. Abstain from every form of sexual intercourse. Abstain. When you abstain, you are as good as staying on your own, and there's no way that virus will fly. Because remember that the commonest one I said is from sexual intercourse. However, you have to do the other things I mentioned to prevent yourself from getting it. That's second. That's first. The second thing is be faithful to your partner. Be faithful to your partner. If you have a partner, you are married, you have a partner, please be faithful. Men, be faithful to your wife. Wife, be faithful to your husband. Stop going, away march. It will not solve most of the problems that we have. Then if you are not married, be faithful to whoever partner. If you cannot abstain, let that partner also be faithful to you, because the issue is that you may be faithful to your partner and your partner is not faithful, has different people that he's fondling with. And the thing is that if your partner is not faithful to you, I swear you are not faithful. Invariably, you are not faithful, rather, because your partner having sex with others, you are as well having sex with those people. I don't know whether you understand it that way, but just take it. So be faithful to your partner. The next is consistent and good use of condom. You are sleeping around. That sexual intercourse is not supposed to be unprotected, because you are sleeping around. You don't know the person that the person you are sleeping with has slept with. You don't know the person that you don't know the person that you are sleeping. You don't know the person that the person you are sleeping with has slept with. So consistent and good use of condom. Use it correctly. Use it always. Now that's that. Then the next is drugs. If you're already HIV positive, please take your drugs. This will help you to live a longer life, live a healthy life, and suppress the virus as much as possible. Now, let's go to post-exposure prophylaxis, pre-exposure prophylaxis. We encourage girls, if you are raped or sexually assaulted, and we don't know the status of the person that assaulted you, please come to the hospital immediately. Within 72 hours, we can place you on post-exposure prophylaxis for HIV. If you have needle prick, or somehow you got exposed to a source that you think is contaminated with HIV, please come to the hospital immediately. There's a drug we'll give you, and you will not be able to get HIV. We'll call it post-exposure prophylaxis. Now we are introducing pre-exposure prophylaxis. That, for example, if a man is married to a woman that has HIV, and we don't want that man to get it before this time sexual intercourse, we place her on pre-exposure prophylaxis. You see, then he will also continue with post-exposure prophylaxis. So there are methods for you not to get HIV. Then do the other things I said. Now, if you're already infected with HIV, please take your drugs. Now, if you're watching me and you don't know anything about HIV virus, you have not screened yourself, please, if you're watching me and you have screened yourself in the last 3 months, please raise your hands. If you have not screened yourself, you're not doing yourself good. Visit any good facility, screen yourself for HIV. Today is World AIDS Day. We want 0 death from HIV. We want 0 transmission from HIV. We don't want the transmission to continue. So please, help your life, help us all, help the nation, help the world. Now, if you're HIV positive, it will do you good, more good, that you don't go on transmitting to others. What you don't know that there are two subtypes, HIV1 and HIV2. Now, if you have HIV1 and you go on to transmit, you will get the HIV2. And sometimes you may now become resistant to one. You may get a one that is resistant to the drugs. You see, that is why you need to be faithful. Take your drugs and live a healthy lifestyle. Do not fondle with things you're not supposed to fondle. If abstinence, be faithful, consistent and good use of condom, and take your drugs. And if you have not subscribed to my page, my name is Dr. Nkiruka Bridget. At OBGYN Talks with Dr.Adazion, I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health on my page. Subscribe and share this video, share it. Let us celebrate, let us commemorate this World AIDS Day. I'll show you the pictures of where we went to a school to talk about it. Anyway, let me stop here. Thank you. Hit the notification button now. See you next time. Love you.